What if I told you that millions of women experience miscarriage, yet many still don't fully understand what actually happens inside the body during one? For some women, it begins with light spotting. For others, it starts with cramping that feels different from a normal pregnancy. And sometimes, there are no warning signs at all. Miscarriage can be emotionally devastating, confusing, and frightening, especially when nobody explains what is physically happening inside the body. In this video, we're going to carefully and compassionately explain what miscarriage really is, why it happens, what changes occur inside the uterus, what symptoms women may experience, and what recovery looks like afterward. Now let's begin. Part 1. What is a miscarriage? A miscarriage is the natural loss of a pregnancy before the baby is able to survive outside the womb. Most miscarriages happen during the first trimester, especially before 12 weeks of pregnancy. And while miscarriage is incredibly emotional, it is also surprisingly common. In fact, many pregnancies end before a woman even realizes she is pregnant. To understand what happens during a miscarriage, we first need to understand what normally happens during early pregnancy. After fertilization, the embryo travels into the uterus and implants into the uterine lining. The body immediately begins creating a support system for the developing baby. Hormones rise rapidly. Blood flow increases. The placenta begins forming, and the uterus transforms into a protective environment designed to support life. But sometimes, development does not continue normally. In many cases, the embryo stops developing because of chromosomal abnormalities. This means the genetic instructions needed for healthy growth were incomplete or incorrect. And when this happens, the body may recognize that the pregnancy is no longer developing properly. Eventually, the uterus begins the process of ending the pregnancy naturally. This process is what we call a miscarriage. Part 2. Why do miscarriages happen? One of the most important things to understand is this. Most miscarriages are not caused by something the mother did. Many women blame themselves after pregnancy loss. They wonder, was it something I ate? Did I work too hard? Did stress cause this? Did exercise harm the baby? But in reality, most miscarriages are caused by problems that could not have been prevented. The most common cause is chromosomal abnormalities. This means the embryo received the wrong number of chromosomes during fertilization. When that happens, the baby may not be able to develop normally. The body then naturally stops the pregnancy. Other possible causes include hormonal problems, certain infections, severe medical conditions, problems with the uterus, immune system disorders, uncontrolled diabetes, or problems with the cervix. Age can also increase the risk. As women get older, egg quality naturally declines, which increases the chances of chromosomal abnormalities. Still, many miscarriages happen for unknown reasons. And having one miscarriage does not automatically mean a woman cannot have a healthy pregnancy later. Many women go on to have completely healthy babies afterward. Part 3. The first signs of miscarriage. For many women, miscarriage begins gradually, and the first symptoms may feel confusing because some of them can also happen during normal pregnancy. One of the earliest signs is vaginal spotting or bleeding. This may start as light pink or brown spotting, but as the miscarriage progresses, bleeding often becomes heavier. Some women may pass blood clots or tissue. Another common symptom is cramping. These cramps are often stronger than normal menstrual cramps. They may come in waves as the uterus begins contracting. Why does this happen? Because the uterus is trying to expel pregnancy tissue from the body. In some cases, women also experience lower back pain, pelvic pressure, loss of pregnancy symptoms, or fluid discharge. For example, nausea and breast tenderness may suddenly disappear. But it's important to remember, bleeding during pregnancy does not always mean miscarriage. Some women experience spotting and still continue to have healthy pregnancies. This is why medical evaluation is extremely important. Doctors often use ultrasound scans and blood tests to understand what is happening. Part 4. What happens inside the body during a miscarriage? Now let's talk about what happens inside the body during a miscarriage. When a miscarriage begins, hormone levels, especially HCG and progesterone, start to fall. These hormones are essential for maintaining pregnancy. As hormone levels drop, the uterine lining can no longer continue supporting the pregnancy. At the same time, the cervix may begin to soften and open. The uterus then starts contracting. These contractions help push pregnancy tissue out of the uterus. This is why cramping can become intense. The amount of bleeding varies from woman to woman. Some miscarriages happen very early and resemble a heavy period. Others may involve more significant bleeding and tissue passage. Depending on how far along the pregnancy was, the tissue may include blood, the gestational sac, placental tissue, and embryonic tissue. For women further along in pregnancy, the experience can be physically and emotionally more intense. In some cases, the body completes the miscarriage naturally. This is called a complete miscarriage. But sometimes, tissue remains inside the uterus. This is called an incomplete miscarriage. When this happens, medical treatment may be necessary to prevent infection or excessive bleeding. Part 5. Different types of miscarriage. Not all miscarriages happen the same way. There are several different types. The first is a threatened miscarriage. This happens when bleeding occurs, but the cervix remains closed and the pregnancy may still continue. Some women with threatened miscarriage go on to have healthy pregnancies. The second is an inevitable miscarriage. In this situation, bleeding and cramping occur and the cervix opens. The body is actively progressing toward pregnancy loss. Then there is a complete miscarriage. This means all pregnancy tissue has left the uterus. Bleeding and cramping usually begin improving afterward. An incomplete miscarriage means some tissue remains inside. This may require medication or a medical procedure. There is also something called a missed miscarriage. This can be especially heartbreaking. In a missed miscarriage, the embryo has stopped developing, but the body has not yet recognized the loss. This means there may be no bleeding or cramping at first. Sometimes women discover it during a routine ultrasound when no heartbeat is found. Another rare but serious condition is an ectopic pregnancy. This happens when the embryo implants outside the uterus, often in the fallopian tube. An ectopic pregnancy is dangerous and requires immediate medical care. Part 6. What does a miscarriage feel like? Every woman experiences miscarriage differently. For some, it feels similar to an extremely heavy menstrual period. For others, the pain can be far more intense. Cramping may come in waves. There may be pressure in the pelvis. Some women describe feeling contractions. The emotional experience can be just as overwhelming as the physical one with shock, fear, confusion, grief, and guilt. These emotions are extremely common. Many women feel attached to their pregnancy from the moment they learn they are expecting. So even an early loss can feel deeply painful and traumatizing. And because miscarriage is often not openly discussed, many women feel isolated. But miscarriage is far more common than many people realize. Millions of women around the world have experienced it. Part 7. How do doctors treat miscarriage? Treatment depends on the type of miscarriage and how the body is responding. Sometimes doctors recommend waiting for the body to complete the miscarriage naturally. This is called expectant management. The body may pass the pregnancy tissue on its own over several days or weeks. In other cases, medication may be used. Certain medicines help the uterus contract and remove remaining tissue. Doctors may also perform a procedure called dilation and curettage, often called a D&C. During this procedure, the cervix is gently opened and tissue is removed from the uterus. This may be necessary if heavy bleeding continues, tissue remains trapped inside, or an infection becomes a concern. Many women are frightened by the idea of a D&C, but it is a commonly performed medical procedure. Doctors also monitor women for complications. Warning signs that require immediate medical attention include severe bleeding, fainting, fever, severe abdominal pain, or signs of infection. Part 8. Recovery after miscarriage. Recovery happens in two ways: physical recovery and emotional recovery. With physically, the body often heals within a few weeks. Bleeding gradually decreases, hormone levels fall, and the menstrual cycle eventually returns. Ovulation may even happen within a few weeks after miscarriage. Doctors sometimes recommend waiting before trying for another pregnancy, depending on the individual situation. Emotionally, recovery can take much longer. Some women recover emotionally relatively quickly. Others experience deep grief for months or even years. And both experiences are valid. Partners may also grieve differently. One person may want to talk constantly. Another may become quiet and withdrawn. This difference can create misunderstandings during an already painful time. Support is extremely important. Many women benefit from counseling, support groups, family support, or speaking openly about the experience. One of the most harmful myths surrounding miscarriage is the idea that women should simply move on. Pregnancy loss is real loss, and emotional healing deserves compassion and time. Part 9. Pregnancy after miscarriage. One of the biggest fears women have after miscarriage is this: will I ever be able to have a healthy baby? The answer for many women is yes. Most women who experience miscarriage later go on to have healthy pregnancies. Even after multiple miscarriages, successful pregnancies are still possible. Doctors may recommend additional testing after repeated losses. This can help identify hormonal issues, genetic conditions, blood clotting disorders, or structural problems in the uterus. For many women, becoming pregnant again after miscarriage can be emotionally complicated. Excitement may exist alongside fear and anxiety. Every symptom may feel terrifying. Every ultrasound may feel emotionally overwhelming. This emotional experience is extremely common after pregnancy loss, so you are not alone. Part 10. Common myths about miscarriage. There are many myths surrounding miscarriage. Let's clear up a few of them. Myth number 1. Exercise causes miscarriage. In most healthy pregnancies, normal exercise does not cause miscarriage. Myth number 2. Stress always causes miscarriage. While severe stress affects overall health, most miscarriages are caused by chromosomal problems, not ordinary emotional stress. Myth number 3. If you miscarry once, you will miscarry again. Most women who miscarry once later have healthy pregnancies. Myth number 4. Miscarriage only happens in older women. Miscarriage can happen at any reproductive age. Myth number 5. Early miscarriage is not emotionally serious. For many women, the emotional pain is profound regardless of how early the pregnancy was. To conclude, miscarriage is one of the most emotionally difficult experiences many women will ever face. But understanding what happens inside the body can remove some of the fear and confusion surrounding it. During miscarriage, the body recognizes that the pregnancy is no longer developing normally. Hormone levels fall, the uterus contracts, and pregnancy tissue is expelled from the body. The experience can involve bleeding, cramping, emotional pain, and physical recovery. And while miscarriage is common, that does not make it emotionally easy. If you or someone you know has experienced miscarriage, remember this: you are not alone. And in most cases, miscarriage was not caused by something the mother did wrong. If you found this video helpful, consider subscribing for more medically accurate pregnancy education videos explained in a simple and compassionate way. And if you'd like, you can also share your thoughts or experiences respectfully in the comments below. Take care, and thank you for watching.